doctor.
Netcare's Milpark Hospital is exceptionally proud of their dedicated transplant unit. Over the last 22 years, specialist surgeons at this facility have performed hundreds of successful life-saving operations.
Of the organs that can be transplanted, are lungs quite difficult?
Yes, I think lungs are the most difficult because they are the most vulnerable organs in the body. They are very big and they're very delicate.
Suffering from the inherited lung disease cystic fibrosis, 4 years ago a lung transplant was the only hope Alice had of seeing her next birthday. Now aged 27, an organ donor literally saved her life.
It's obviously been a very difficult journey for you.
When I was still at school, it was actually not too bad. I managed to live a normal upbringing. At university, I started struggling a bit more. By 4th year, when I was doing my honours, it got too hard to go to class. I couldn't cope with walking and carrying books. It was too much.
How frustrating it must be to put such a limit on your life.
Yes, it is, especially at that point. I was 22 years old, so all the friends I studied with had finished and they were starting their careers and, you know, everything that I should have been doing, and I was going backwards, and, you know, I felt like a 90 or 100-year-old sitting at home, not being able to breathe while everyone else could just carry on.
When you realised you needed the lung transplant, your condition was obviously very, very serious.
Yes, definitely. The rule of thumb for listing someone for a lung transplant is that they should have a 50% chance of surviving the next 2 years. When I got called for the lungs 8 months after being listed, you know, my heart almost stopped. So I woke my mom up. We were a bit frantic, you know, like what now? You know, we're in PE and it's midnight and the airport's closed. So we booked a flight online, first flight up to Joburg, and yes, I was in the hospital and ready to go by 8 o'clock.
Milpark Hospital's staff have also benefited from the cutting-edge technology at this groundbreaking unit. Plastic surgeon Dr Gereth Edwards received a life-saving heart transplant.
Dr. Edwards, you've had a heart transplant. What was the reason for your transplant?
I had a heart attack. I was busy operating in between cases, and I realized I was going to have a heart attack. Fortunately, I had 2 cardiologists having lunch in the area, and they started my resus. Over the next 2 months, we realized that I couldn't get enough blood through the heart, and therefore I needed a transplant, and I was transplanted back at Milpark by the same surgeons and cardiologists who saved my life.
What has it done for your quality of life before and after?
You know what, it's changed my life because I understand gratitude, firstly, and secondly, I do realize that we have to give back. Unfortunately, I can't still work, but I can talk, and I'm trying to get my voice part of the cause.
What are the risks involved?
You are taking an organ into your body that is not your own, and it is at constant risk of being rejected by the immune system of the body. So you have to take a large amount of medication to suppress that immune system. And this is dangerous. It leads you to be at risk for infections and malignancies and all kinds of other side effects. And the risk of infection and rejection never ever goes away completely.
It must be extremely rewarding to have treated a patient like Alice.
Absolutely. You know, they always teach us that you shouldn't become emotionally attached to your patients, but you certainly do. Alice has become a friend of ours. In fact, my daughter was a bridesmaid at her wedding, and we were most privileged to attend her wedding. But she's crept into our lives, as she does into everybody's lives. The improvement in her life is such a testimony to transplantation in general that it gives us encouragement for doing the next patient and the next patient. So even when things go badly with some of our patients, as they invariably do, one can always look back to patients like Alice and think, yeah, well, it is worthwhile.
Breathing deeply, Alice is now able to enjoy life's most simple pleasures.
After listening to Alice's story, it really shows the importance of becoming an organ donor. Because even though your journey has come to an end, you can help somebody continue theirs.
I want to live the best life.